Greetings, everyone, and welcome back to Sex Empowerment with Helen and Halima. We're at episode 6, and we're having an amazing discussion today about pelvic floor health. Helen, this is going to be great, yes?
Hi everyone. Yes, really one of my favorite subjects.
Yes. So let me guys give you why this is such an important topic for me personally, and actually probably why we're even doing this podcast. I had suffered a pelvic floor dysfunction. I think I reached out to Helen in the middle of the lockdown in 2020, I think. And
Yeah.
this is amazing that I had the time to dedicate to the practice. And so once I figured out what I needed, I saw Helen a YouTube channel, her YouTube channel, and I'm like, I have to hire this person. And she happens to be the only English speaking person that I saw. I'm like, oh my God, I hit the jackpot. So we had a consultation, and I think we started working together a couple weeks after that. And we've been doing things working together ever since because this process and training changed my life. It reversed the issue that I had. I've had a lot more confidence. I've had more power in my body. It's just an amazing what I can say about it. I'll share maybe a little bit more later, but it's really important to me that we get this information out because so many women are suffering with pelvic floor dysfunction and they don't think that they can heal, or they're getting so much misinformation, and they get exhausted by trying one thing that doesn't work, trying a different thing that doesn't work, taking, getting, you know, all kind of information. And by the time 5 6 years later, they still have the issue and they haven't had any sense of relief. Sometimes they even get even more worsening symptoms, right, Helen, when you don't get the right information, the right training. So that's my little spiel about my experience.
Unfortunately, pelvic floor issues, they're very progressing issues. So when your time matters and quality of stuff that you do matters as well, because if you waste your time on doing wrong things, or you're kind of provided with information and you are left alone to do it, or unsupervised, or incorrectly, you can cause actually much more problems to yourself. And of course it affects not just your health, your psychological health. It affects you on many levels. It affects your relationships, it affects your professional life, your social life. So it all can go to pieces. And I've seen tragic stories, like women who suffered and lost everything just because of problems they had with their pelvic floor.
Yeah, and it's a big issue with your self-esteem as a woman, like, your confidence level. And when I see these commercials, Helen, about these female diapers and they show them all having fun, I'm like, this is criminal,
It's
because there's
criminal.
things that women can do to not only prevent it, to support them getting back their health. So this is a really big topic. I know a lot of younger women are now experiencing prolapse.
Yeah.
Um, and there are also other, female dysfunction. And we're going to talk about men as well, because obviously we've talked about male sexuality before. But so far as what to do, so let's start there, Helen. Like, what to do. Um, well, maybe we'll start with why the pelvic floor is such an important part of sexual health and overall health.
Pelvic floor muscles, they are responsible for the most intimate areas of your life. We're talking about process of urination, bowel movement, sex, and childbirth in women. So, of course, these muscles that control these important processes, if they're damaged or overstretched or weak, then normal kind of biological functions start to interfere with your daily life. And why it happens? It happens because of many reasons, because of our modern lifestyle, because most of us spend very inactive lifestyle, believe it or not, because we spend a lot of hours in front of the computer in a sitting position, then we drive home or we drive somewhere, or we sit on the couch, watch TV. Also, the quality of food that we consume, the pollution affects our health, affects our, the products that we consume, the like the strength of tissues of these muscles affected by the low quality food and water and all the processes that happening inside us. Of course, the level of stress and anxiety that we currently experiencing with the life, stressful life around us, it affects our hormonal balance, and hormones affect our pelvic floor as well, very much. And of course, if we talk about women go through process of childbirth, pregnancy and childbirth. It can't go unnoticed, of course, for female body, because a lot of problems happen after that, because women are not prepared for pregnancy. They go into pregnancy being unprepared, and pregnancy is not designed to be traumatic. Childbirth is not designed to be painful, and of course, after childbirth period is not designed for women to go through agony of pain and all those sufferings that a lot of women unfortunately go through. uh, it's just basically suggests that there is like a very high level of ignorance in that. And yes, because this type of muscles, they're invisible, and the way where they're located, we never see them, we never feel them, we never know what's going on until problem starts, and that's when we finally realize that we have pelvic floor. But unfortunately, when problem already starts, that's quite too late, believe it or not, to obviously prevent it, because these muscles, they're very fragile, they're very tiny, but they play essential part in our body, because they hold our organs, our pelvis organs, our bladder, our uterus, our rectum. It's all a kind of, all these organs, they're in that suspended position. They're not attached to anything, and they're these small muscles, they're holding that thin layer of muscles holding these organs. And if these organs go out from their anatomical positions, that's where all these problems start.
Yeah, it's one of those things where since you don't see them, you don't realize how important they are until there's
Yeah,
some form of dysfunction. And there's levels to the dysfunction, stages to pelvic floor
stages.
prolapse and
Yeah,
things like that, right? So prevention is, you know, um, primary, right? You want to be able to prevent it, and we
yeah.
prevent it with getting knowledge and information. Um, Now, I remember when I went to a pelvic floor therapist after I had been training with Helen for a few months, and they were shocked.
Mhm.
These people were trained in pelvic floor therapy, and I was telling them when I was doing a little bit, and they were like, "Whoa, whoa, whoa," you know. And I wanted to just get an update on my pelvic floor health. A lot of the information women are getting, both men and women are getting, are maybe is not accurate, or it's not, it can't really support them in achieving their health. So can you talk about the process that you shared, or your system and training, and why that is very helpful to restoring your pelvic floor health?
Well, I would say before you engage in any system, for
Hmm.
example, if you feel that you experience pelvic floor issue, you go and see doctor. This is kind of the first point of contact. Go and see doctor. But I would say to you that before you engage in absolutely anything, whatever doctor advises you to do or whatever you hear, you need to do a research. You need to um, invest some time to learn about stuff that is proposed to you, because it's your health. And quite often there are lots of things that exist in this world, and even doctors can offer you quick fix that has really traumatic consequences, unfortunately, because it can ruin your life for good if you do it. But there are also lots of systems as well. So it's important to kind of do your investigation, your research, and understand that when it comes to pelvic floor, what is important? It's important to, again, to learn your anatomy, to learn what you're going to deal with, to learn which exactly muscles are you going to get are going to get involved in the system. And it's not just one muscle or group of muscle, it's the whole body that is involved in the system. And for example, in my system, we start with posture, because posture is essential. It's essential part. It's kind of like a foundation. If your posture is incorrect, then the rest of the body organs and body parts, they are kind of misplaced. They are not in the right position. So that can cause problem already. And then obviously working with a specific muscle group that is responsible for your pelvic floor health, and building it gradually. So when we train pelvic floor, we start with really simple exercises, and then gradually we build up this knowledge through training uh, with equipment or with just exercises. And what is important is to understand, when you start working with pelvic floor, there shouldn't be any worse symptoms. So your symptoms should not get worse. So if, for example, you started doing exercises and you realize that actually, my health starts to deteriorate, I started to experience more pain or more leaks or more incontinence, then don't continue, don't waste your time. Then it means that something is not right, that you are doing something that causing more damage than bringing you benefit from this advantage. Then you need to stop immediately and go back to that person who's teaching you this, or you know um, do something, change something. Another thing is, there are lots of commercial programs that offer you to, for example, put patches on your thighs, or sit on a big chair, and your pelvic floor will be fixed within 5 minutes. It's not possible, because how how you going to fix something like without even knowing where it's located. And it's not a magic, it's not a magic pill. It's a process, it's a system, it's a training. And there are lots of equipment as well, commercial equipment that is invented for pelvic floor. And some of this equipment as well, like you put it in and you do nothing, and it should kind of work for you and resolve your problem, unfortunately. But that's also, it drops your motivation, first of all, because if you don't see progress, your motivation goes. And secondly, it can cause a lot of damage as well, because you don't know what you are doing. So you have to be completely aware what you're doing, and whatever you hear should resonate with you as well. So that's one of of my advices.
I love that, because the quick fix can get you. And especially if you're in a lot of pain, right? You want to get out of the pain.
Yeah.
Also, I think that for me, it was really, um, I took the practices very seriously. Um, and it was like I was stepping into a university.
Yes.
Yeah, it's like I learned so much in a short period of time about my body than I had learned from previously combined all the years previously combined about my body. And what happens is, I think, um, the quick fix is like putting on like a bodysuit that hides your fat. Eventually, you gotta take it off, and you're gonna be dealing with the fat, right? It's
Mhm.
great to how it looks, but if you were to work out in the gym, or do something, walking or swimming or whatever, to get your body a certain way, then that's going to be what it is, regardless of what you have on or not. And I think that
Mhm.
the quick fix is the cover up, because it does require discipline, 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 discipline. But once you
Yeah.
discipline yourself to get through the basics, it becomes easier to maintain than than initially.
Yeah, absolutely. But it's the hardest part of this training, to be disciplined and to be motivated
Yeah.
and to find time for yourself, because people prioritize different things. But then when you are already suffering from pelvic floor related issues, that should be your priority, not anything else, because
Hmm.
otherwise, your life going to be ruined. And
Yeah.
unfortunately, that's what I was witnessing, and I'm still witnessing with clients who come with pelvic floor issues. And everybody's so different, and everybody has their priorities in a different order as well.
Yeah. We see that when we put on our masterminds or our intensives. One prospect was having severe prolapse.
Hmm.
But it was Christmas time, and she wanted to invest into buying gifts for her grandchildren or
Yeah,
children. I was just
the
like,
children.
wow.
Yeah,
Like, wouldn't a great gift be a healthy mom, and vibrant, radiant woman? You have a lot more energy, you have more confidence. Like, why not invest in yourself?
absolutely. It's a lot of cases with self love I deal with when I speak with women. It's a big issue, like a like when you have on scale, yeah, investing in myself, in my health and my well-being, or buying like another kind of toy or another piece of clothes for my family, like for my child. So getting your priorities straight.
Awesome. And I definitely agree with that. So when we talk about that, we understand, like, some of the issues that women have, with their some men have as well: prolapse, urinary incontinence, more severe things as well. Um, and I know
Sexual
that
problems, sexual
sexual
problems.
problems that it bleeds in every area of your life. When we go to the doctor, I know some of the things they recommend were, like, women having a mesh if they have
Oh, yeah.
prolapse, and I also hear that cause so much different problems, or surgery even. A lady reached out, I believe she had surgery, and she couldn't feel anything. She just hated that she had the surgery.
Yeah.
Um, so
Yeah.
go ahead.
Unfortunately, doctors are trained in these methods. Doctors are not trained in alternative medicine, or they're not trained in fitness, or
Mhm.
even physiotherapists who, like, obviously supposed to kind of supposed to resolve your problems with fitness. They have still limited kind of knowledge when it comes to pelvic floor for some reason, especially when it comes to pelvic floor. For some reason, physiotherapists are trained in a different way, and a lot of incredible things that could help their patients, their clients, are not even mentioned in their books, in their training programs. I don't know why. I've read like a lot of literature, like for physiotherapists, and I haven't found stuff that can be very useful for them, for their patients. And
Mhm.
there is a reason behind that, because obviously physiotherapists, doctors, they are following the program controlled by pharmaceutical industry, and they are programmed to use stuff that pharmaceutical industry produces and making money on. So it's
Mhm.
not in their interest to offer something that will help their patients to cure forever, and not to need their services or medications
Right.
in a way.
Yeah, and surgery and like these meshes, these are all some of the things they do offer. And they also some suggest Kegels. So let's talk about Kegels. Do they actually support the pelvic floor?
Kegels, if they're done correctly, and remember that Dr. Kegel didn't invent them, right? Dr. Kegel used them from ancient practices. And Dr. Kegel actually used to travel to African tribes, and he was always inspired how these African tribes used ancient knowledge to prepare women for childbirth, for pregnancy, for childbirth, and how quickly they used to recover from childbirth. And he studied those cultures, and he found out about these exercises from there, and started to implement them in his medical practice, because he was traditional medical doctor. But the way he was introducing these exercises to his patients was very different from the way modern doctors introduce these exercises to their patients, because modern doctors, unfortunately, they don't have time to deal with this, to explain these exercises properly. And it's not in their interests actually to kind of waste their time on this, because it's much more expensive to do surgery to a patient and make much more money on that, rather than have this headache with these exercises that take longer. And the reason why I'm saying this, because I attended medical conferences, and I heard what kind of quite bright and advanced doctors, who are not really, dependent financially on their practice because they're so successful. They were free in telling this to younger doctors, saying that, hey, there is surgical procedures, but there are also alternative ways how you can help your patients. You don't have to jump to surgical procedures if there are ways to help your patients other way. So these are basically this something that kind of shocked me, to find out that in fact doctors, like traditional doctors, they even have this how to say it, protocol to offer patients to do Kegels without explaining properly how to do these Kegels, and waste a bit of time, because patient may be still not ready for surgery yet. Some time needs to pass. So say in a few months, when patients come back and says, oh, sorry, these Kegels didn't work, then doctor has a great excuse to offer them surgery and tick the boxes saying, oh, but I offered alternatives, it didn't work, so now I can offer, with a peace of mind, I can offer surgery for my patient. But that practice exists among doctors. And why they don't explain how to do Kegels? Simply because some of them don't know. They don't really pay attention to that, because there is much more expensive procedures, much more profitable, and like I said, why to bother with that, right? Um, and some doctors, so mainly ignorance, mainly that they don't know themselves. There are exceptional doctors who are medically trained, and they have interest in alternative medicine, and they combine these two. These doctors, I think, they don't have value. They are like incredible. They're like worthless doctors, I would say.
Yeah, yes.
There
They
aren't many of them like this, unfortunately. They are, but there
mhm,
aren't many of them.
mhm. I think the explanation, because I know, like, for the past maybe 15 years, a lot of talk and discussion regarding the pelvic floor has been about yoni eggs and jade eggs, and
Mhm,
I've studied the jade egg practice as well. And I think not a lot of detailed explanation with
mhm,
what you're was really doing. So a lot of women would just either don't understand it specifically what's happening, um, and to train the muscles that support the pelvic floor, they're like just inserting something in them, not understanding just the whole aspect of the body piece that your system provided.
yeah.
And so again, it's that Kegels with no explanation. It's like, okay, let me get a yoni egg, and then that's going to do the work. But it doesn't, because you really don't understand, unless you do, of course, the dynamics of like the transverse, abdominal muscles and different part breathing and posture, and the different Kegels that we do. So it was, you know, I know the difference firsthand from having, very low level information and then stepping into a system where you fully understand. And that gives
Mm.
you confidence, because you see how, say, like Udiana, you see how everything goes together to support the pelvic
Yeah.
floor versus just getting a tool and or just saying squeeze and release. These are very simplified um, practices that aren't, there's not a system to support the whole body in training the pelvic floor.
Yes, absolutely, because your body works as a system. You're absolutely right. You can't just look at one little technique, take it away, and expect results. You have to look at it on the whole. And there aren't that many, programs that would look at it as a whole. So some believe that okay, Kegel exercises is a panacea for everything. No, it's not. It's just tiny little fraction of exercises that, if done correctly, yes, they can have really good positive effect on your pelvic floor if done correctly. I again accentuate this, because if they're not done correctly, and if you read explanation online, the way they're explained, they can cause more damage to your body and to your pelvic floor than benefit.
Mm-hmm.
And it's just tiny little fraction of the whole system that is involved in training your sexual health, your pelvic floor health.
Hmm. One of the feedback I received when I went to the pelvic floor therapist, was that my I was able to isolate
Mm-hmm.
the parts of the pelvic floor. And so that was something they seemed to be excited or
Surprise.
amazed. Yeah, they were surprised. Like, what are you doing? Um, but that's something when you really understand, you have to. And I'm, we tell clients who join our courses that discipline is key. And again, if you begin to connect to your body in a different way. The
Mm-hmm.
thing is, like, we're so used to avoiding the pelvic floor unless you have a problem or with menstruation or sex. We're not used to putting our focus there. So we're
No,
not in tune with the sensations, the feelings, isolation. So you're really having a deeper intimacy with your body, which in that intimacy you care for, because you understand this right here, like this 10% of the body, it really is the control panel.
absolutely.
Hmm.
That's where everything starts. If you look at chakras, right? This is
Yeah.
your I am is basically that's your first chakra, where your pelvic floor is, your
Yes.
root.
The
And
root for a reason, right? It's the
yes,
root for a reason. Yeah.
yes. And I absolutely agree with you with the isolation, because pelvic floor muscles themselves, like bulbar cavernosus muscle and levator anus muscle group, levator ani muscle group, it's kind of like a group of muscles. They're so tiny, and they're surrounded by really well developed bulky muscles, like muscles of your gluteus maximus, muscles of your leg, muscles of your abdomen. Do you know that your anus is connected to your abdomen? So quite often when you contract your anus, you contract your abdomen. And that's the problem, because if very well developed muscles get involved in the workout, then pelvic floor muscles are not involved, they're not working. And quite often you read this description about Kegels, how to do Kegels, and you spend your time, you diligently doing Kegels as it says in the description, but in fact you're exercising your buttock, and it
Right.
has nothing to do with your Kegel muscles. And then a few months later you say, oh, these Kegels don't work. I tried my best, but it just didn't work for me. I wasted my time. Yes, because you were exercising wrong muscles, and it's
Yeah.
very hard to do, to exercise the right one, because you are not isolating weak muscles from strong muscles.
Yeah. That's it. That's it's
Yeah,
the misinformation and the misguidance, because Kegels do work, but if you're not able to isolate,
yeah,
because we're recruiting the muscles that we recruit um, the abdomen and the thigh muscles and your glutes, to
yeah,
do the work where we need to really, get really in there and connect with those muscles. And I think that that made the difference,
yeah,
isolation, and then you really understand it. The way you provided the education is that you understand what you're doing, and whereas like with doctors just give you a pamphlet or a sheet, if they
yeah,
give you that, and then you just go in and you're trying it yourself and you have no clue. You think you're squeezing. Oh, they'll say, oh, hold your bladder, and those are the
yeah.
muscles to. They'll say, how many times I heard that one.
Yeah, that's horrendous, because you can actually ruin the reflex. You can confuse your brain when you interfere with urinary reflex. You can confuse your brain doing that. So it's very dangerous to do as well. And it's,
Yeah.
yeah, they explain it quite often in that way, and in online as well.
Mhm.
Stop urine in the midstream or something.
Mhm. Mhm.
Another thing, how many doctors explain the importance of your diaphragm on your pelvic floor? How many
Oh yeah.
doctors explaining, or even physiotherapists explaining that the main reason why you're suffering from urinary incontinence, or from prolapse, is because you can't control your abdomen, you can't control your diaphragm. Your diaphragm is obviously pushing down. And I
I
haven't
had
heard
never
that.
heard that. I had
Yeah.
never heard that before until I took the training. Like
Mhm.
how the pelvic floor and the diaphragm are working in
Together.
tandem. Yeah, and
Yeah.
it's like, whoa, okay. You're learning so many different things. So if you are not can't control your diaphragm, or if you're doing a lot of breathing, if you're not breathing correctly, all of that
Effect.
can
Yeah.
your
But
pelvic floor.
so many clients who come and say, oh, I've seen doctor, I've been to physiotherapy, it didn't work for me, maybe you can help. And then when I start to ask them, what exactly did you learn, what exactly you were given to do? Oh, one of the most popular exercise, scissors. I was doing scissors. Why? You haven't prolapse and you were doing scissors. It's it's a crime, and stuff like this. Like, there are lots of stories, obviously, I could tell about that, but it's just, it is what it is.
It definitely is what it is. So, what are some of if someone wants to start today, let's say they just wanted to start with one step and getting more intimate and having more pelvic floor health and
Mhm.
strength, what would you recommend?
Well, first of all, I would recommend not to do it on your own. Get
Mm.
yourself specialist who, obviously specializes in pelvic floor treatment non-medically through fitness. Read reviews, speak to the person, study the system, what it's all about. So that would be obviously the start. Unfortunately, it's very hard to kind of find out the quality and whether it will work for you or not,
Right.
because but this is like part of the process, finding the right specialist as well, finding the right program for yourself.
Mhm. I would agree with that so far as getting the support. And although um, we live in different countries, we were able to successfully. I was able to successfully be trained online. I mean, like it's amazing. Like Helen didn't have to be physically with me
Yeah,
for me
and
to
that
get the
that was
results.
probably one positive thing during COVID, that it taught me to to teach this stuff online to people, you know.
Yes, it was amazing. I had the time, I had the best instructor and the best training, the best mentor. So I would agree, definitely get support because there's a lot of things you just do not know. Because of support, you're going to get the education and then you're going to get the accountability. You're going to get the instruction, which is critical in the beginning process of it.
Yeah.
So, mhm,
I want to show you equipment, one of the equipments that we use
mhm,
in the training system. So this equipment is basically used in order to self-diagnose yourself. So you can use this equipment in order to see in what condition your pelvic floor is. And also, when you train, you can track the progress, how your muscles are building its strength. So if you just do Kegels, you just, contract, relax, you don't know what are you doing. You can hardly feel this. With this equipment, you can see what's happening, how your results are changing. And I also believe this is like one of the best equipments in the world, because it allows you to train the deepest muscles of Levata Ani group, muscles that you can't reach with any other equipment that currently exists, that currently been invented. And it resolves a lot of problems for women. So it will help with urinary incontinence, it will help with hemorrhoids, it will help with reducing the size of vaginal canal, especially after childbirth. So basically, if you train properly on this equipment, then in a while your vaginal canal will become the same kind of tightness and size as it was before childbirth. I know that a lot of women prefer to do cesarean section because they don't want to be like they say, to push, right? They don't want to be
right.
overstretched. But this specific equipment helps you to kind of go back to your, like, I would say, virgin size, if you like.
Ladies, you want that, right? And I think that goes to the point with childbirth being prepared because you can
Hmm.
use these exercises to get prepared for the pregnancy, childbirth, and post. Like getting back to snapping
Yeah,
back to where you once were. So this is a very important as well for preparation.
absolutely.
hmm and I love the laser because you really get clear where you are, and every week
Yeah.
you see your progress. You see how you're strengthening your muscles. Um,
That
and it's
helps with your motivation.
yeah, that's your motivation. Whereas you're sticking something inside of you, you're not really quite sure. You'll get really clear with this,
Hmm.
with the laser where you are, and it gives you like goals to reach for every week, every month, whatever you want, however you're doing it. But it's consistency, right, Helen, that makes
Hmm.
the difference with these exercises.
Yeah, it's consistency. It's not a quick fix. It's not a magic pill. It's just, I normally say to my clients, it's like it has to be part of your routine. Like, when you go brush your teeth, put on makeup, it's part of your routine. Whether you like it or not, it's there. So it has to be part of your routine.
Hmm.
Just find time for this, integrate it in your lifestyle, in your daily routine.
Hmm.
And maybe at the beginning you need to spend a lot of time while you are learning, because there are lots of things you are learning that not typical, and that you are not used to, and for your body it will be quite shocking at the beginning. But then in a while it becomes like a second nature, and you don't even need time, special time for that. You can do it while driving your car, while shopping, or while speaking to someone, or while watching TV, or whatever.
Hmm.
Even during sex, there are exercises that you can still do while having sex with your partner.
So obviously we making the connection between we're making the connection with having a very healthy, strong pelvic floor muscles versus and how that happens to give you a better chance of great orgasms and better sex life. Like your training will help you as an individual with your pelvic health, and also amazing sex with your partner.
Absolutely. And you're becoming fully in control of that. You're becoming fully in control of your amazing sex. You know that
I love
you
it.
have power of experiencing that. And that
Hmm.
gives a lot of difference to your self-esteem. There is
Hmm.
something happening inside your self-esteem when you have this knowledge.
Hmm.
And there is no secret that, actually, I would say there is no surprise that in ancient times this knowledge was a secret knowledge. It was only available to kind of concubines, to like privileged women, I would say. Not all the women would have that knowledge.
Yes, right. Because I know that different systems, it was kept for the empresses or the like the courtesans to the king, etc. Now this information is available to everyone, but at the same time, not a lot of women are interested, or maybe they want the outcome. I mean, everyone wants the outcome, right? I guess
Yeah,
they were saying, yeah, but the discipline that it requires.
yeah, that's the problem. So finding the time, prioritizing yourself, that's a big problem. Self-love.
What would you say would happen, Helen, if a lot of women begin to learn these practices with sex mastery? What would you think would happen to like the relationship, our current state of relationship?
Oh
Yeah.
gosh, I think our world will change. I think we would not have wars in this world. Because there won't be any need. Wars are only, who creates wars? Losers who have nothing else to do, who are deprived of everything. Like, yeah, they have money, but they're deprived of great sex, of great love, of humanity.
Mm.
And unfortunately, partly it's women's fault. And I think if there were many more women who were happy, who were sexually developed, who were kind of developed to their kind of goddess state, that would probably change the world, the status of it.
Absolutely. That means that we're going to have harmonious relationships. Sometimes
Yeah.
we try to overanalyze it intellectually, like, okay, this is the problem with it's hypergamy. It's this, is that, is statistics.
Yes, unfortunately, I blame a lot of women for what's happening these days,
Mhm,
because there are so
mhm,
many women who are not secure, and they're not developing their potential. They're not developing their femininity. They're
Mhm.
wasting their time on something that is kind of not designed for them. And that brings us a lot of unhappy, insecure people in this world, a lot of really low quality relationships. Because in the end of the day, woman is responsible for um, seduction. Woman is responsible for the quality of relationships. Woman is responsible for success of her man, because she gives him power of self-belief. She gives him confidence. She nourishes him with that kind of feeling good about himself. I'm actually currently reading a book written by one urologist, American urologist actually, and he talks about this from a scientific medical point, because men are very penis oriented. Every like the kind of their ego, their confidence is so penis is basically, it's kind of like it's like a continuation of their ego, of their
Mhm.
confidence. And
Yes.
I absolutely love the way he explains it, how it affects, their performance and the way they feel about themselves on their success, how it affects success, how their attitude to their penis obviously affects their success in life.
Mhm.
And of course, woman plays essential part in that process,
Yes.
because she
Yes.
makes him feel if he's great or if he's not. And then it obviously affects a lot of other areas of his life. It's quite interesting. So if women were confident in themselves, if they were in charge of their femininity, then definitely our world would be different.
And I know a lot of women resist these conversations or resist this. And I also think because femininity is packaged as glamour, which is something
Mm,
totally different. I think we're not really understanding that the essence of femininity is a woman's energy, right?
yeah,
And so not necessarily how she looks, or like the pinup girls and the centerfolds and all of that. Um, Actually can be a watered down image of femininity, right? So
yeah. There
a
is
lot
so
of
much negativity attached to
yeah,
femininity, right? Like weakness, like
yeah,
deprivation, like rights, and so on. Like
yeah,
has nothing to do with femininity, with that energy you're talking about.
right. It has nothing to do. They don't even mention you talk about femininity. I rarely hear people talk about the energy aspect of it, the sexuality of it, the sexual technology that she has, because, and I think that's why a lot of women resist it. But I also think that the power that's promoted in this country around the world is masculine power, is that exerting and taking control or manipulating and force,
Yeah,
that the female power is rarely demonstrated. Is
no,
is not demonstrated, like, say, in the media, if you will, mainstream media, if you will. So there's
no,
no
because
images of it. Hmm.
yeah, because whoever's behind this, it's not in their interest to promote female power, because there is no war in female power. There is no aggression. There is no competition in female power, because woman gets everything without war. Woman doesn't
Yes.
have to. Woman who is connected to herself, who knows her value, who knows her power, who developed her femininity, she can get anything in this life without war, without competition, without trying to prove something to somebody. Unfortunately, the way it's portrayed these days is that she has to fight, she has to compete, she has to show to a bloke non-existent dick that she has.
Yeah, this is the strength. Like I have, like
Yeah.
like they're kind of, yeah,
As
with the
soon as she,
female.
yeah, as soon as she turns into this, she loses her power as a woman.
We need to do. We have to do another. uh, on just female power, because the reason why I'm saying is because sometimes we haven't seen our mothers exhibit it, or maybe it's not in our family. Maybe we've been looking at something that we have mistaken as female power, but we really
Mhm,
haven't seen the it in its full form. Like the images that we see, I don't really see. I see some remnants of it in certain characters on television, but again, you
mhm.
saying they don't put that out there because it will definitely change the dynamic of our world when this is accessed and actualized in women. So when you said
Mm.
that women are responsible for relationships, okay, okay, so I can hear women like, no, and
Yes.
I think, why does it feel so heavy? Because I hear women say, why can't men? Why can't men? Why does it feel so heavy for women to take that responsibility?
Uh, well, first of all, because there is a lot of confidence issues, a lot of self-esteem issues
Mm-hmm.
inside, and a lot of expectations on kind of, women are waiting to be chosen. They're not taking responsibility for like basically choice, for quality of relationships. They are delegating whatever happens on guy's shoulder.
Yes.
So
Hmm.
he's that, he's best at his this, like
A
they
dog.
come, yeah, they
Yeah.
come to meet someone looking through the prism of hatred, of negativity, and they
Mhm.
expect, they expect that a nice guy, even if it's like a nice good guy who potentially, right, that he looked at as a piece of shit, that he will behave like a nice guy. No, he wouldn't. Okay,
No.
if he's treated that way, he will turn into that. If you expect this to be ugly stuff, you'll get ugly stuff. You can't
Right.
expect to, you know how to say it, if you don't feel like a goddess inside, and you feel like vulnerable, weak, angry, damaged, with lots of kind of problems, and you come to to meet someone, or you come into relationships, you can't expect these relationships to bloom. You need
No,
to have
you
good,
can't.
huh?
No, I'm agreeing with you. I'm sorry. Mhm.
Yeah, you have to come, you have to have positive intentions, but you can't have positive intentions if deep inside you is a mess.
Mm,
So everything starts with you, everything starts within yourself. And if there are lots of unresolved conflicts, lots of problems inside, it will be reflected outside. You can't just, expect things to be as easy if deep inside there are lots of unresolved conflicts. And a
yeah.
lot of women go through that at the moment.
Yeah, they feel they can receive something outside of their belief. So if you
Mhm.
believe that all men cheat, or all men are dogs, or if you
Yeah.
feel all those things, you can't have anything outside of your belief system. So with that being said, your expectation isn't that you meet this wonderful, amazing, loving person. Your expectation matches your belief. You expect to believe you expect to have your belief validated. You're gonna
Yeah,
find the very guys that you hate, that you don't like, that you
absolutely.
talk secretly about. So it's a deeper conversation about that. But I love what you added to that about waiting to be chosen and putting delegating the power and the responsibility on men's shoulders. That's powerful.
And then how can you consider yourself a woman if you don't even know where your vagina is? If you've never seen it in your life?
Yeah.
I'm sorry, ladies, but when it comes to your femininity, when it comes to your body, a lot of you don't even know what it's like. You're ashamed of it. You're
Yeah.
disconnected. You hate it. You believe that, oh, it has to be this or it has to be that. My body has to be this. My body has to be that. Let me put another kind of Botox in my body. Let me change something in it. Like, you can't rule the world. You can't be responsible for happy, healthy relationships if there are lots of problems inside you. So start connecting.
Take a breath on that one.
Start connecting with your vagina.
Yeah.
How about that? There's a fantastic book. We already mentioned it by Virginia Woolf. And
Naomi Wolf. I know. I always
Naomi,
get those
sorry,
confused. Yeah.
Naomi Wolf. Yes.
And another amazing writer, Virginia Woolf, but that was way
Yeah,
back in the day.
yeah, yes. It's a little bit
um,
different subject. Yes. So Naomi Wolf, vagina, and I think that's mentioned there that everything starts from that sacral organ.
mhm. And this is the center of your femininity. It's just,
Mhm.
it is your energy. And so the pelvic floor is very, I mean, to me, you can't talk about female power without mentioning the pelvic floor and sexual energy. It's to
Absolutely.
me, it's incomplete at best.
Hmm.
Um, Anything else you want to add to before we close? I know we're coming up against our time, but anything else you want to add? There's so much to say about the pelvic floor. You see how it bleeds into everything: your confidence, your esteem, relationships, your seat of power as a woman. Anything else you want to add before we close?
Just wanted to add that there is also erection fitness. This is fitness for men,
Okay.
which is quite important because men have sexual centers in their body responsible for their sexual health and their sexual performance. And quite often, these centers, again, they don't know where to locate them and how to activate them. But once you locate them, activate them, involve them, engage them in full activity, that's like, will work till the rest of your life. And that's
Mm,
important to learn this stuff. So stop taking Viagra, stop taking any of this kind of commercial things that they try to promote to you. Work with your resources, work with your body, because you've got a lot inside. You just need to activate it. You need to put it in practice.
yeah. And that requires discipline, discipline, discipline,
Yeah,
discipline. And I just want to say that whether you're single, if you're single or married, but if you're single, this is a great opportunity to get in a intimate relationship with your sexual energy and your pelvic floor. It's an amazing time. So, and this is actually preparing you for that relationship that you truly desire. So treat it as a sacred time for yourself to get intimate with yourself, to really strengthen and empower yourself, increase your energy. Trust me, it's an investment that I'm telling you, no amount of money is just an amazing investment in yourself. And if you are also married, this is going to just help you blossom more and more and more in your relationships. So it doesn't then some people say, "Oh, it's for single women," or is it married women? No, it's for
yeah.
every woman, whether
Every,
you have every woman, whether you have a pelvic floor issue or not. Great if
yeah.
you don't, because um,
Then
you
you
can
can
make
concentrate on sexual aspect of this, because if you have pelvic floor issue, first you have to resolve this issue and then think about or do it kind of simultaneously, but obviously it's better when you don't have issues.
Absolutely. So this is the perfect time. The perfect time. And then also when you don't have it, you getting into the preventative aspect, right?
Hmm.
By you doing this and developing your muscles, you're preventing anything happening later on down the line. So it's actually preventative as well. So it's a win-win.
Absolutely. Yep.
Awesome. Well, with that, we're going to say goodbye to you all. Thank you for listening, and we'll see you next time.
Thank you all. See you next time.